Hey everybody, I'm Dr. Seth, psychologist, and today in this video, I want to talk about something that I call the small-souled person. Okay, the small-souled person. You have heard of people talk about other people as heartless or maybe even evil. You have certainly heard people talk about narcissists. The problem with narcissism today is that not everything is narcissism. Narcissism is such a common, popular word today that some people are having that label slapped on them, and that's not actually what it is. Well, what I am going to talk about today, when I talk about the small souled person, is you can think about it as just a step sort of beneath the severity of narcissism. There is something that I have looked for in my career. I have worked with so many patients over 20 years of being a clinical psychologist, and I have worked in all different kinds of settings: outpatient clinics, hospitals, locked psychiatric units. All of my early training was in hospitals, and I certainly learned about clinical disorders and the clinical names for certain disorders. And many times, those names, those terms, those disorders do fit. However, there isn't always perfect clinical language to describe some of the things that everyday people feel and deal with in their lives. And so that is how I came to this term, small souled person, because none of the other terms could describe what I was seeing in over 20 years of clinical work. I have worked with so many different people over the years who have talked about a whole wide range of problems. I've heard more problems than you can probably count. And yet, I have heard a through line with so many of the people that I've worked with, a through line about a particular type of personality that has a really upsetting effect on them, people in their personal life or their romantic life, maybe in their family. This particular type of person or personality that causes them to feel disappointment, that causes them to feel hurt. This type of personality often makes them feel confused. Why did they say that? Why did they do that? Why would they do that to me when they care about me? Now, to really understand what the small souled person is, who that person is, we really first have to talk about what is a soul? What does somebody look like who has a full, healthy, vibrant soul? And the person who is a healthy soul, a full soul, the number one thing is they practice kindness. They practice kindness. Kindness just kind of oozes out of them. They don't just practice kindness with their family members or their best friends, the people in their own myopic social circle, but they practice kindness really across the board with their fellow human beings. They may volunteer. They may go out of their way to help a neighbor. They feel a sense of connection. They feel connected as a soul because their soul feels things. They feel connected to others. And what's important to note is a really full or healthy soul also feels some sense of responsibility to think about, reflect on, and care about their fellow souls. Think about a whole group of people holding hands, all lined up. Picture them lining the whole side of one street, and it just goes on and on and on. The person who has a healthy, full soul and has that internal sense of balance, what they also feel is a rootedness, a connectedness to others, to their fellow humankind. They see themselves as just one person holding hands, like I described, in a whole chain of people. They know that they hold hands with the person on their left and that that person holds their hands with another, and that we are all connected. There is that mutual sense of care. So a soul isn't just kind to one person or to family or to others that they know in their own inner circle, but to the community overall. Okay. That's what a full, healthy soul is really about. And if you want a super simple way to think about what a full, healthy soul looks like, it looks like the opposite of selfish. The healthy, full soul is giving, is generous. And again, not just to the people in your inner circle, but as a rule, a healthy, full soul, it is in the fabric of who they are. It is part and parcel, as some people love to say, it's in their DNA of who they really are, is to be generous. But again, it is not just to a select few, it is not selective. It is communal. It is like communal mindedness. Okay. One of the things to understand about somebody who has a full, healthy soul is that the full, healthy soul has the capacity for deep empathy, real empathy, really feeling things deeply for other human beings. They have that capacity in them. One important point to understand about the person who has a full, healthy soul is that they have the capacity for deep empathy, real, true, deep empathy, true feeling for others. Okay. They feel it in their bones. They don't just think about what they want, they also think about what others want. They think about what others need. So I think having described that, you probably get the sense how big a point connectedness is. So now that I have talked a little bit about what the full healthy soul is like, I can share about what the empathy looks like for someone who is the small souled person. Now, a small souled person, it doesn't mean they're a bad person. It doesn't mean they're heartless. In fact, that's the whole point of the term. This description, though, of a small souled person does describe a limitation. A limitation because a soul could be bigger. A soul could be more focused on others and more generous and caring and practice more kindness. So the small soul, the small souled person, is limited. And it's important to understand that so that people don't take the actions of this kind of person personally. In fact, it's a handicap. This is a major limitation, a sort of narrow mindedness that gets acted out in life. I've already mentioned that the empathy of the small souled person is limited, but I want to share the ways that it's limited. And it's limited in two different ways, okay? One, the limited empathy can feel performative. It can feel almost like it's a performance. So, somebody who is small souled, they may say things that make it seem like they understand that it's time to show empathy for someone else. They may say superficially empathetic things like, "Oh, that's so sad," or "I'm so sorry to hear that." They may say those words. Sometimes to people, it can feel like they mimic empathy. It can feel like this is almost intellectual empathy, that the individual understands, this person said something, and the socially appropriate thing to do in response is to say something that shows empathy. So the problem is that they often feel just like words. They feel just like words that were sort of issued at a socially appropriate time, but it feels more performative. It's just quick and fleeting, and then it's done. And that relates to another component of the limited empathy that you see with someone who is small souled. And that is the quickness of it, how fleeting and changing this type of feeling can be. Now, let me just sort of give an example to flesh that out. If you hear about a situation that is really upsetting and sad, if you hear that and you are somebody who has the capacity for deep, real, true empathy, you feel that, you actually meet them in that feeling, you You feel it. You can see as I'm talking about this, the look on your face may change. Wow. And you're holding it. It's actually as if you are metaphorically holding on to the pain, the emotional pain that you are hearing about, that you are able to imagine and feel with this other person who's telling you something that's so upsetting. Okay. Well, after they have said it and the two of you are ready to move on, if you actually have the capacity for deep empathy, you don't just shift a second later, at lunch into saying something like, "Will you pass the salad?" Or you're walking down the street or you're on the phone and you say, "So, what are you going to do later?" No, you don't shift that quickly when you have deep empathy. Why? Because if you have deep empathy, the feeling is still there. It takes a minute. Why? Because on a feeling level, it really registered. You are impacted. You're affected by what you heard. Now, when you have the capacity for deep empathy because you have a full, healthy soul, it might take you a minute or two, and you can, of course, get back to your regular mood, but a good minute or two with someone who has limited empathy, the kind of limited empathy you see with just a small souled human being. They say the right things, but not a second later, their mood is completely unimpacted. Their mood is completely unaffected. They're just ready to go back. It's almost as if 4 minutes ago, you hadn't even shared anything that was that upsetting. Do you see what I mean? There seems to be this lack of this current relating the previous moments to the current one. There's this disconnectedness, this detachment the small-souled person feels when they hear about upsetting things, when they try to access their empathy. So they can access it, but just a little, not in any deep, real, connected way. When you connect with empathy and you have a deep capacity for empathy, you are connecting with something deep in yourself, memories, beliefs, a whole complex emotional and thought system. And that is a beautiful thing. Empathy, deep empathy, that capacity that we have as human beings, it's what makes a full soul full souled. And it is what we miss so much when we identify someone who feels small souled to us, who feels emotionally narrow minded, and who can shift in and out of superficial or shallow emotions. It's limited. It's limited and it's not really and truly connected and rooted. Okay. So I've been talking about the small souled person in this video, and I will continue to talk about this in other videos so I can help people better understand what this looks like in daily life, in everyday life, in many different ways. I'm Dr. Seth, psychologist.